Hi everyone, here's Paula from thepowerofozone.com, and today I'll be posting more material from a course that I participated in Nizhny Novgorod, Russia. This is where the Russian method was invented. And here what you see is Dr. Oxana Lebedeva. She is teaching the course participants how to perform subcutaneous ozone injections. And what she's doing right now is she is injecting ozone at a concentration of 10 to 12 gamma in between the vertebrae of a patient who is suffering from lower back pain. So she is injecting that under the skin, not into the joints, but under the skin. Ozone can also be injected on the side of the spine. So you basically go like half an inch to an inch, both to the right and the left of the spine, and continue with the ozone injections. The Russian doctors, they recommend to perform the injections along the sides of the spine where the nerves are coming out, in order to trigger an irritation of the nerves. They claim that this has a therapeutic effect. The ozone concentration is very low. It's 10 to 12 micrograms per milliliter, or gamma. And what you do, you inject in each point just a few milliliters and then move on to the next one. And as you can see, the needle is also very small. I believe it's a 6 millimeter needle. And now once that is done, what you also do is you inject ozone subcutaneously into what the Russians call bioactive points. Now, to me, it's not entirely clear what type of points those are. I believe they correspond to acupuncture points, so basically where meridians run, but I'm not 100% sure on that. So here they're trying to locate one specific bioactive point, and afterwards they're going to move down the back of the legs until they reach the feet. And as mentioned, they can be quite uncomfortable, although you wouldn't tell that from the reaction of this patient here. But having had those injections performed on myself, I can attest to the fact that it's not the most pleasurable thing. As you can see, the Russians, they prefer not to work with anesthetics, but of course you can use them to lessen the discomfort. Those subcutaneous ozone injections seem to be pretty popular in Russia, and they're used for a variety of conditions. Here, for example, we see a patient who's suffering from headaches, and he's actually receiving those injections into his head. And as he reported afterwards, they have lessened the pain quite considerably. The use of those type of injections into the head can actually stimulate hair growth, and this is also something that is being used in Russia. And from what I understand, Dr. Lahodny in Austria, who invented the Tempest method, is also known to apply this technique. Another area where subcutaneous injections are used is cosmetology. This is something I presented in a previous video. So injections into the face, under the skin, can apparently stimulate collagen production. The ozone for all those injections was generated from oxygen produced by an oxygen concentrator, which put out 90 to 95% pure oxygen. This course was really one of the most fascinating and the most informative I have taken so far, and I can highly recommend it to any ozone professional. So if you're interested in participating in that course, please contact me. You will find my email in the description below the video. Thank you for watching.